Hello and welcome back, and a warm welcome to you if you're new to this channel. There are a few videos on this channel on how to get rid of boils. There's been lots of questions and lots of interaction on these videos. So today I'm going to share with you some differences between folliculitis, boils, and carbuncles. These are all skin conditions that look like boils. So our topic today is what is folliculitis, what is a boil, and what is a carbuncle. We are going to look at the definition of these, look at the symptoms as well, and then we'll explore the treatment. So first of all, what is folliculitis? Folliculitis is an inflammation of hair follicles due to an infection, an injury, or irritation. It is characterized by tender swollen areas that form around hair follicles. It often occurs on the neck, the breast, and the buttocks. So note this, folliculitis is an inflammation of a hair follicle. Now boils. Boils are also referred to as furuncles. They're pus-filled lesions that are painful to touch and usually firm. Now, a boil will develop when an infection around the hair follicle spreads and becomes deeper, and boils would usually develop under the arm, in the groin area, on the neck, and under the breast, sometimes too in between the thighs. Now, what is a carbuncle? Carbuncle are clusters of boils that develop on the back of the neck or on the thigh. Now let's look at the symptoms of folliculitis, boils, and carbuncles. Now take note of this. Symptoms may vary from person to person. Symptoms of folliculitis may include pus in the hair follicle. It may also include redness or an inflammation. The hair can get damaged. Symptoms of a boil may include a painful lump in the skin, pus in the center of the lump. There can be white, bloody discharge from the boil. And symptoms of carbuncles, that is clusters of boils, may include pus in the center of the boils, a whitish, bloody discharge from the boils, fever, fatigue, tenderness, and pain at the site. The symptoms of folliculitis, carbuncles, and boils may resemble other skin conditions, so always make sure you speak to your healthcare provider for advice. Let's move on to diagnosis and treatment. First of all, diagnosis. Diagnosis would always have to be made by your healthcare provider. Diagnosis would normally be provided after your medical history has been checked and there has been a thorough physical examination of the boil, the folliculitis, or the carbuncle. Sometimes your healthcare provider will take a sample of the drainage and send it to the lab. This will help them select the best treatment. The type of treatment selected will be based on so many factors. It will be based on your age, your overall health, your medical history, the severity of the condition, whether you can tolerate that treatment, and your preference is also taken into consideration. Topical antibiotics are normally prescribed for folliculitis. For boils and carbuncles, if it's not very severe, your healthcare provider would advise that you use a warm compress to help with the drainage. If it's very severe, that is if the boil is very big and painful and you're suffering from feverish conditions, then they would prescribe an antibiotic. Sometimes a surgical incision would be required. That is, the skin would be opened up for the pus to come out so as to get rid of the infection. Surgical incision happens in rare cases where the boil does not drain as expected. Sometimes, too, based on your health, you are offered oral antibiotics to help treat the boil or the carbuncle. Painkillers such as paracetamol can also be taken if the pain is very severe. And as always, make sure you speak to your healthcare provider for advice if you have any questions. As much as possible, make sure you carry out all preventive measures to prevent folliculitis from spreading, to prevent boils from spreading to other parts of your body, and to prevent carbuncles from developing. Make sure you wash your hands thoroughly with soap and warm water after touching any infected part of your body. Avoid sharing towels, washcloths, and razors with anyone. And make sure that if you've got any dressings on your boils or carbuncles, you change them often. Place the used dressing in a bag and seal it tightly. I hope this video is helpful. Please give it a thumbs up. Share with your family and friends, and leave your questions in the comment section. Please remember to subscribe if you haven't yet subscribed to this channel. Subscription is free. Thank you once again for being with me up to this point, and I hope to see you soon in my next video. Bye for now.